Welcome to Atlantic Cape Community College's Exposure Control Plan training. If you have not yet completed the Safe College's Bloodborne Pathogen Training course, please close this course and complete that one first. Thank you. In this course, we will be discussing Atlantic Cape Community College's Exposure Control Plan and the details that you need to know to keep yourself safe. This plan covers the Mays Landing campus, the Atlantic City campus, and the Cape May Courthouse campus. What is an exposure incident? OSHA's bloodborne pathogen standard defines an exposure incident as specific eye, mouth, other mucous membrane, non-intact skin, or parenteral contact with blood or other potentially infectious materials that results from the performance of a worker's duties. At the Atlantic Cape campuses, it is most likely that employees may encounter blood, vomit, excrement, or sewage that may result in an exposure incident. The New Jersey Public Employees Occupational Safety and Health Act, or POSHA, has adopted the OSHA bloodborne pathogens standard to protect New Jersey public workers from these health hazards. Each employer must perform an employee exposure evaluation. If employee exposure, as defined by the standard, is recognized, the employer is required to develop and implement an exposure control plan, which must include training, work practices, engineering controls, personal protective equipment, and hepatitis B vaccinations. The ECP must also include practices and procedures for housekeeping, medical evaluations, hazard communication, and record keeping. Atlantic Cape's written ECP explains the following provisions: program administration, employee exposure determination, effective dates, exposure control plan, engineering controls, personal protective equipment, training, hepatitis B vaccinations, post-exposure evaluations, information for healthcare professionals, housekeeping, labeling, record keeping, and identification of first aid providers. Employees, which include full and part-time employees and student workers, performing the following jobs at Atlantic Cape have the potential for occupational exposure. Security officers and athletic trainers and coaches can have exposures while administering first aid. Maintenance, housekeeping, and ground staff can be exposed while cleaning and disposing of spills and waste. They can have sharps injuries, injuries from equipment use, or exposure to sewage. Allied health, HPI, and nursing staff can have exposures due to needle sticks and other sharps injuries. Culinary arts staff can have exposure due to knife accidents and other sharps injuries, burns, or injuries from equipment use. Professors, instructors, and lab staff in the biology and chemistry departments can have exposures from biology lab materials or animal blood, burns, sharps injuries, or injuries from equipment use. And art professors, instructors, and staff can have exposures from sharps injuries and injuries from equipment use. Good Samaritan acts by employees performing jobs not identified in the previous slide, but which result in exposure to blood or potentially infectious material from assisting a fellow employee, are not included in the bloodborne pathogen standard. However, POSHA encourages employers to offer post-exposure evaluation and follow-up in such cases. All such exposures must be immediately reported to security and human resources. Next, we're going to discuss how to avoid exposure through the use of universal precautions, engineering controls and work practice controls, and the use of personal protective equipment. Universal precautions. All personnel must utilize universal precautions. Universal precautions are infection control methods that require employees to assume that all human blood and specified body fluids, and possibly animal blood and body fluids, are infectious for HIV, HBV, and other bloodborne pathogens and must be treated accordingly. The Safe College's bloodborne pathogen training course that you should have taken before this course discusses specific universal precautions. Engineering controls and work practice controls will be used to prevent exposure to bloodborne pathogens. Atlantic Cape uses the following controls. Biohazard and leak-proof bags or rigid containers with biohazard stickers are available to all employees for waste disposal when cleaning up blood and/or other potentially infectious material. Puncture-resistant disposal containers for sharp objects, needles, syringes, glass, will be placed near the point of use for the disposal of regulated medical waste. Ventilated laboratory hoods will be used where applicable for the control of aerosols. Readily available hand washing stations will be provided in many areas, or when not available, antiseptic wipes or other waterless hand sanitizers are available and should be utilized. Employees must wash their hands as soon as possible after removing gloves or after unprotected or ungloved contact with blood or other potentially infectious material. Proper biohazard warning labels will be affixed to all waste bags and containers, and non-disposable cleanup equipment will be properly decontaminated. Eating, drinking, smoking, applying makeup or lip balm, handling contact lenses in areas where there's a likelihood of occupational exposure is prohibited. Food or drink must not be stored in refrigerators, freezers, on shelves, in cabinets, or on countertops where blood or other potentially infectious materials are stored or present. Specimens, blood, or other potentially infectious material must only be placed in a container that prevents leakage during collection, handling, processing, storage, transport, or preparation for disposal of these items. Personnel should examine any equipment that may be contaminated with blood or other potentially infectious material prior to servicing or shipment and decontaminate such equipment as necessary. Equipment must be labeled if not completely decontaminated, and a prominent label or sign indicating that the item was not adequately decontaminated must be affixed to the equipment prior to moving or servicing the equipment to eliminate exposure to other people. PPE must be worn by all college personnel whenever it can be reasonably anticipated that they may have contact with or exposure to blood, feces, urine, or other potentially infectious materials. Face shields or safety goggles with a surgical or dust mask will be worn by all personnel when splashes, sprays, spatters, or droplets of blood, urine, sweat, or any other possibly infectious material pose a hazard to their face, eyes, nose, or mouth. Some of the PPE that may be necessary for certain tasks are listed in this table. The PPE can include disposable gloves and face masks, face shields with eye protection if splashing is expected, tongs if sharps are being cleaned up, jumpsuits, foot coverings if splashing is expected, and CPR masks for those performing CPR. On a side note, work gloves are not proper PPE for bloodborne pathogens. If you're performing a task where you need to wear work gloves and there still is the potential for exposure, you should wear disposable gloves under your work gloves. And if the work gloves become contaminated with blood or other potentially infectious material, those gloves should be discarded if they cannot be decontaminated. All PPE will be readily available from shift supervisors at the beginning of each shift in sufficient quantities to last through the workday. All other personnel determined to have the potential for occupational exposure, unless properly trained and authorized, should not attempt blood or other potentially infectious material cleanup or first aid. If an incident occurs, immediately notify security. Biohazard bags and labels will be available in each department where regulated medical waste materials may be generated. Bags can also be obtained from the compliance officer. Each area where regulated medical waste may be generated should contain red biohazard bags, leak-proof bags with biohazard labels, or solid biohazard containers. Contaminated PPE must be placed inside biohazard bags or containers and disposed of through the compliance office or lab or campus areas with biohazard disposal. Where appropriate PPE, when it is anticipated that contact with other potentially infectious material may occur, and when handling or touching contaminated items or surfaces. Replace any non-disposable PPE that may become torn, punctured, contaminated frequently, or if the ability to function as a barrier becomes compromised. Never wash or decontaminate disposable gloves or other disposable PPE for reuse. Wear appropriate face and eye protection, such as a mask with a face shield, when splashes, sprays, spatters, or droplets of blood or other potentially infectious materials pose a hazard to the eyes, nose, and mouth. If blood or other potentially infectious material penetrates a garment, the garment must be removed immediately or as soon as feasible. Pullover type garments must be cut off to avoid contamination of the face. Following initial bloodborne pathogen training, the hepatitis B vaccination series is available through Atlantic Cape's Occupational Health Services at no cost to all employees who are reasonably anticipated to have occupational exposure to blood or other potentially infectious materials, unless the employee has previously received the series, proof of the vaccination is requested, antibody testing reveals that the employee is immune, medical reasons exist that prevent the employee from taking the vaccination, or the employee chooses not to participate. While not mandatory, all eligible employees are encouraged to receive the HBV vaccination series. However, if an individual chooses to decline the HBV vaccination, then that individual must sign documentation of refusal that will be kept with all records in the compliance office. Some other highlights of the HBV vaccination program are: participation in pre-screening is not a prerequisite for receiving the HBV vaccinations. The HBV vaccinations will be provided at a later date, even if the employee initially refuses. You can change your mind. Employees must sign an acceptance or declination sheet, and vaccinations are administered in accordance with United States Public Health Service recommended protocol. Should an exposure incident occur, the employee should contact his or her immediate supervisor as soon as possible. The supervisor will contact security, human resources, and the compliance officer. Each exposure must be documented by the employee on an exposure incident report. If possible, participants should save the offending material in the event testing is deemed appropriate. Employees are strongly encouraged to immediately report to the nearest hospital emergency center, urgent care center, or as directed by human resources or security for a confidential medical evaluation and follow-up. Blank exposure incident report forms are attached to the exposure control plan, or you can obtain one by contacting the compliance office at 609 343 5112. The hospital or emergency center that the employee goes to after an exposure incident is to be advised that the patient is an employee of Atlantic Cape Community College and that the exposure is a work-related incident. The following elements will be performed: documentation of the route of exposure and the circumstances under which the exposure incident occurred, particularly if medical sharps were involved. Document the brand, type, and size of sharps if applicable. Identification and documentation of the source individual unless the employer can establish that identification is unfeasible or prohibited by state or local law. If consent is obtained, the source individual shall be tested as soon as feasible to determine HBV and HIV infectivity. Consent is legally required for testing to be done, but it is not mandatory for the source individual to grant it. When the source individual's consent is not required, the source individual's blood, if available, shall be tested and the results documented. Or when the source individual is already known to be infected with HBV or HIV, testing for the individual's known HBV or HIV status need not be repeated. Results of the source individual's testing shall be made available to the exposed employee, and the exposed employee shall be informed of applicable laws and regulations concerning disclosure of the identity and infectious status of the source individual. The exposed employee's blood shall be collected as soon as feasible and tested after consent is obtained for HBV and HIV serological status. If the employee consents to baseline blood collection but does not give consent at that time for HIV serological testing, the sample shall be preserved for at least 90 days. If within 90 days of the exposure incident, the employee elects to have the baseline tested, such testing shall be done as soon as feasible. By law, all test results are confidential. It should be noted that New Jersey law and regulation requires information about AIDS, acquired immune deficiency syndrome, and HIV be kept confidential. While the law requires positive results to be reported to the State Department of Health, the law strictly limits disclosure of HIV-related information. When disclosure of HIV-related information is authorized by a signed release, the person who has been given the information must keep it confidential. After the post-exposure evaluation is completed, when medically indicated, post-exposure measures will be as recommended by the U.S. Public Health Service as follows: counseling, evaluation of any reported illnesses, treatment in accordance with the updated U.S. Public Health Service guidelines for the management of occupational exposure to HIV, and recommendations for post-exposure prophylaxis. Human Resources or the compliance officer will provide the employee a copy of the evaluating healthcare professional's written opinion within 15 days after receipt of the same from the healthcare professional. This written opinion will be limited to whether or not the employee has been informed of the results of the medical evaluation and any medical conditions which may require any further evaluation or treatment. All other diagnoses must remain confidential and not be included in the written report to the college. Spill cleanup procedures. What requires the use of a red biohazard bag or a cleanup kit? Blood and blood-contaminated waste, sharps, which are any materials that have the capability of perforating your skin, and unspecified body fluids or other potentially infectious material, and materials that come in contact with those fluids. How much? If a 4 by 4 piece of gauze or something larger is saturated with blood, use a red bag. If you have just a small bandage, a tissue with specks of blood, or vomit, use the regular trash. Always use appropriate personal protective equipment. Place waste materials in the red biohazard bag that comes in the blood cleanup kit. Transfer the red bag to a biohazard container. In the Mays Landing campus, the container is located at H114. In Atlantic City, it's in the HPI storage room. In Cape May, it's in the housekeeping storage room. Fill out a form attached to the red bag for tracking purposes. Be sure to disinfect the area with a germicidal wipe or with a solution before mopping the floor. And when done and immediately upon removing your gloves, wash your hands thoroughly with soap and water. Anytime a cleanup kit is used, the following form must be completed and returned to the compliance office. This form can be found as an attachment to the exposure control plan. It's also available to all employees through Safe Colleges, and they're available at the compliance office in E106. The typical blood cleanup kits that we use at Atlantic Cape consists of Red Z fluid solidifier, a BioScoop with detachable scraper, Paws antimicrobial hand wipes, vinyl gloves, red biohazard disposable bag and twist tie, Sanizide Pro germicidal wipes, and instructions. It is a good idea when responding to an incident that you bring with you extra disposable towels, disinfectant, and hand sanitizer. A demonstration on how to use the available blood cleanup kits is available on YouTube and through Safe Colleges. It will be assigned to you through Safe Colleges as part of your overall bloodborne pathogen training. For any biohazard cleanup, first call security unless you have been assigned the cleanup by your supervisor. No employee should clean up bodily secretions without proper training. Only designated personnel can perform cleanup, and only after they are up to date with their bloodborne pathogen training. The biohazard cans and sharps containers, again, are located in Mays Landing in room H114, in the Atlantic City campus in the HPI equipment room, and in Cape May in the housekeeping storeroom. The bloodborne pathogen standard requires either fluorescent red-orange biohazard bags or red-orange biohazard labels be affixed to leak-proof bags or containers. The shift supervisor will ensure warning labels are affixed or red bags are used as required. Employees are to notify the compliance officer and their department head if they discover any unlabeled regulated waste. Sharps disposal containers are inspected by the compliance officer and the department supervisor. They are maintained and are replaced by the department supervisor or his or her designee whenever necessary to prevent overfilling. Medical records will be maintained for each employee with an occupational exposure in accordance with PIOSH regulations. All records of employees who have had an exposure incident will be held for 30 years after the employee leaves the employment of Atlantic Cape. Employee medical records shall be provided upon request of the employee or to anyone having written consent of the employee within 15 days of that request. Original bloodborne pathogen training records will be maintained in the compliance office and in the Safe College database. Training records will be made available to the employee within 15 days of a request. Security personnel are designated first aid providers and first responders at all campuses. Athletic trainers, coaches, and athletic staff are designated first aid providers. These job categories must receive pre-exposure training and have been offered HBV vaccinations. In the event of an exposure incident, they will advise security, HR, the compliance officer, and department head accordingly. The compliance officer and supervisor will ensure that all first aid providers receive training and specifics on how to report an exposure incident. If no pre-exposure vaccination has been given, HR and the compliance officer will ensure that all post-exposure medical tests and post-exposure prophylaxis are offered per the standard. All other job categories will immediately notify security in the event first aid is required for any employees or students. In the event of a life-threatening injury, however, notify 911, then security. For questions or concerns about bloodborne pathogen exposures or any other health and safety issues, contact Mary Simpson, the compliance officer, at 609-343-5112 or at msimpson@atlantic.edu. Report an incident, exposure, or emergency, contact security in the Mays Landing campus at 609-343-5125, in Atlantic City at 609-343-4841, or in Cape May at 609-463-6390. And of course, if it's a life-threatening emergency, contact 911. Thank you.